So, good day everyone. I am Norhani Sali Pinagayaw. So, today I'm going to show you the transferring technique. So, what is transferring technique? It is use of proper body mechanics in repositioning, lifting, and transferring patient safety. Purpose, position and prepare client for variety of clinical procedure. So, equipment, bed, wheelchair or chair, and transferring belt. Okay, so procedure. Check the doctor's order and client diagnosis and restriction. Rationale. To determine any contradiction, limitation, and client physical activity. Identify the client, inform client desire, purpose, and to reduce client anxiety and increase cooperation. Rationale. Rationale to reduce client anxiety and increase cooperation. Hi, ma'am.
Hello po.
Kumusta pong pakiramdam niyo? May masakit pa ba sa inyo?
Okay naman.
So, ano pong pangalan natin, ma'am?
Marla po.
Assess the client ability level of comfort, muscle strength, presence of paralysis, and ability to follow instructions. Rationale, to provide information about the client physical abilities to ensure safe transferring. So, ma'am, magagalaw po ba natin ang ating mga kamay?
Opo.
Yung paa niyo po?
Yes po.
Obtain equipment needed and check its condition. Rationale, to avoid accident while moving the client. Wash hands. Rationale, to prevent the transfer of microorganisms. Adjust the height of the bed to lowest possible position. Rationale, to reduce distance that the client has to step down, thus reducing risk of injury. Slowly raise the head of the bed if not contraindicated by client condition. Rationale, minimize lifting dirt by discomfort both for client and healthcare provider. Place one arm under the client's leg and one arm behind the client's back. Slowly pivot the client so the client's legs are dangling over the edge of the bed. Rationale, to support the client while sitting him/her on the edge of the bed. Allow the client to dangle for 2 to 5 minutes. Support the client if necessary. Rationale, to allow time for assessing client response to sitting, reduce possibility of orthostatics, hypotension. Okay, so, ma'am, hindi po ba kayo nahihilaw?
Hindi naman po.
Okay po. So, stay muna tayo 2 to 5 minutes, ha?
Sige po.
Bring the chair or wheelchair close to the side of the bed. Place it a 45-degree angle of the bed. If the client has a weaker side, place the wheelchair on the client's strong side. Rationale to allow the client to bear weight on strong leg. Ma'am, saan po ba yung strong, saan po ba yung weaker sa dalawang paa niyo po? Yung masakit po? Dito po? Sige po. Lock wheelchair brakes and elevate the foot paddles. Rationale to provide stability. Put transfer belt on other transfer aid if needed and secure. Rationale provide safety and hold the patient without stressing joint or limbs. Lift their knees as well, flex with back straight, hands gripping each side of transfer belt. Rationale, transfer belt is grasped at each side to provide movement. Rock client body to standing position in the count of 3 while straightening hips and legs, keeping knees slightly flexed. Rationale, rocking motion give a client body movement and require less muscular effort to lift the patient. So, ma'am, in the count of 3, bababa po tayo, ha? Okay, so 1, 2, 3. Turn the client facing the wheelchair using pivot technique while maintaining the hold other patient transfer belt. Rationale, less effort for lifter and the client. Instruct client to use arm to rest on chair. Rationale, to increase client's ability. So, ma'am, ilagay niyo po yung kamay niyo sa sandalan ng wheelchair. Flex hips and knees while lowering client into wheelchair. To prevent injury to client from poor body alignment. Assess client for proper alignment for sitting position. Support weak side with pillow if needed. Rationale, to make client comfortable. Secure the safety belt. Place client feet on foot paddles and release brakes if you will be moving the client immediately. If the client is sitting on the chair, offer the footstool if available. Wash hands. Rationale to reduce the transmission of microorganisms. Record effect of the transfer. Rationale to provide accurate data in the care of client.